So guys, ABG analysis, let me make it very fast and very clear. So ABG analysis, guys, this is arterial blood gas analysis. Common question is almost in all the medical related examination. So guys, first point is we are taking blood from the arterial blood gas analysis, not from the vein. Vein basically carries what? Deoxide blood, guys. So no use of taking this and analyzing this. Okay guys, so artery, guys, which artery is preferred first thing is radial artery is preferred, second option is brachial artery, third option is femoral artery in case of emergency. Okay, the best option is always radial artery. Okay guys, first option is radial artery. So before you just go through all these things, guys, I somehow the unannotated PDF, which means the proper one, I'll put it in a telegram. I'll put it in a telegram group. Okay, just stay with me for the next 5 minutes. I'll make sure you understand everything. Okay, the first thing that you must know is the values, guys. What do you know? You should know the normal values of pH of the blood is 7.35 to 7.45. Mark this up. Okay, what is the normal value for CO2? It is between 35 to 45. What is the normal value for hydrogen bicarbonate? It is 22 to 26. These are the normal values for. First thing is pH, second thing is CO2 in blood, third thing is HCO3, okay, which is bicarbonate. Okay, these three things are the base that you must mug it up. Okay, then what is the spectrum of this acidity, neutrality, and the basicity, guys? Basically, if the pH is 7, this is neutral. If it decreases, it is acidic. Okay, and if it increases, then it becomes basic. What is the normal pH of blood? It is 7.35 to 7.45. 7.45. What happens if it becomes, like, let's example, guys, for some example, let's take they have given it as 7.95. What is this? It is more than 7.45. It has gone that side. So basicity. Okay, so alkalosis. So that condition is called alkalosis. Okay, let's take another example. They have given the acid as the value for this pH of the blood as 7.10. What does it mean? It has gone that side. So acidosis. Let's take another example. They have given 3. It is again acidosis. Okay, so hope you understood this first point of how this pH range differs and what it denotes. Okay, 7, it is usually neutral, but for blood the normal value for pH is 7.35 to 7.45. Increases, then alkalosis. Decreases, this value decreases, then acidosis. First thing, keep it this in mind. Second thing, what you know is CO2 level. Okay, CO2 level, what's the normal CO2 level? It is again 35 to 45. Very important thing, guys, very important thing. Okay, very important thing, this CO2 is actually acidic. CO2 is what? Acidic in nature. Okay, CO2 is what? Acidic in nature. So this is the normal value of CO2 in our blood. Okay, so here, guys, if 35 becomes 32, let's say they have given the PA of CO2 is equal to 32. What does it mean? Since this CO2 is acidic in nature, if the value decreases, then we have to know that it's actually alkalosis. It's actually what? Alkalosis. Okay, for normal for another example, they have given us, let's say CO2 is 70. What is the normal value? 35 to 45. 70 is more of CO2 levels. Okay, so what does it mean? CO2 is acidic in nature, so more does means it means acidosis. Okay, so pH we already know. Okay, CO2 we just studied. What is HCO3? It is nothing but bicarbonate. Okay, bicarbonate, it is alkaline in nature. Bicarbonate, it is basic in nature. Hope you get it right. So what's the normal level of basis normal hydrogen bicarbonate? It is 22 to 26. What happens if the 22, if they have given value as 24, sorry, they have given value as 21. Okay guys, so here it has the what is the normal value? 22 to 26. So the decreased, so this HCO3, which is basic in nature, the value is decreased. So what does it mean? It means acidosis. Okay, if at all they have given HCO3 value is 40, 8 or 43. Okay, so here guys HCO3 value is 48. What is the normal level? It is 22 to 26. Okay, so 43 is more, so HCO3 levels has increased. Since HCO3 is basic, now we have to mark that as alkalosis. Hope you guys get it right. Okay, these are the things, these are the fucking basics guys, these are the fucking basics. Okay, second point that you must know to crack this particular question is, what is the ideal pH for the blood? Okay, what is the ideal pH? Normal is 7.35 to 7.45. Okay, what is ideal? Ideal means 7.40, just like your just like your girlfriend. Okay, just like perfect answer, 7.40. This is ideal guys. Okay, the ideal one. Okay, 7.35 to 45 it is normal. Okay, 7.35 to normal, no worries. Okay, but 7.40 it's the ideal one. Okay, 7.40 it is the ideal one. Okay guys. Okay, hope you understood all these things. And guys, basically I'll put this PDF in a Telegram, you'll understand everything. Okay, so guys, another the next point. Okay, next point is, whenever you deal with hydrogen carbonate, you always associate it with kidney. Okay, you always associate it with kidney. Okay, CO2 always associated with lungs. Why? Because CO2 is removed through lungs, and the thing which processes hydrogen by hydrogen carbonate is kidney. Okay, because what does it do is, usually kidneys, during filtration the blood comes into the kidney, and kidney reabsorbs the hydrogen carbonate, puts back in the blood for the balancing purpose only. Okay, so just have this in mind. CO2 means lungs, and H3 HCO3 means kidney. Okay guys, and the next point is, and the next point that you must know is, whenever you see lungs, the word that you should remember is respiratory. Whenever you see lungs, which is CO2, okay, we should know the first point guys. Lungs, CO2 means lungs. Okay, HCO3 means kidney. Second point is, kidney means metabolic. Okay, and here lungs means respiratory. Hope you get it right. First point, CO2 means lungs, lungs means respiratory. Okay, this is the first thing. Okay, for HCO3 means it is kidney, kidney means metabolic. Okay, so this is how you should you are getting this point. Are you getting this point? See, I'll tell you again. CO2 removed through lungs. HCO3 responsible for the organ responsible for this is kidney. So whenever you see CO2 connected to lungs, whenever you see HCO3 minus connected to kidney. Okay, whenever you see lungs, okay, you have to connect it to respiratory. Whenever you see kidney, respiratory connected to metabolic. CO2 connected to lungs, lungs connected to respiratory. HCO3 connected to kidney, kidney you see connected to metabolics. Okay, okay guys. So the next point is guys, what they will ask us to find is, what kind of compensation is this? What is meant by compensation guys? Basically compensation is nothing but, if it is abnormal, if the pH value is abnormal, the any of the substance increase or decrease to actually compensate the abnormal blood pH. Okay, wait a minute. Okay, yeah, so guys, there are three things. Okay, there are three things, which is uncompensated, partially compensated, fully compensated. Okay, okay guys, so let's check this with an example. 7.20, it is the pH they have given. What is the normal level of pH? It is 7.35 to 7.45. So it is 7.20. What does it mean? It means acidosis. Okay, it means what does it mean? It means acidosis. Okay, I have always told you CO2. CO2 means what? CO2 means lungs. Lungs means what? Respiratory. You have to remember the word respiratory. What is the normal value of CO2? It is 35 to 45. Here it is more. Okay, here it is more. So what does it mean? CO2 is acidic in nature, so its value is more than 35 to 45. Here the value is 52. So what does it mean? It is acidosis. Okay, you can write it is acidosis, which is very rare. But just because here lung CO2 is present and you have to connect it to the lungs, and whenever you see lungs, I have told you what you should remember: respiratory. So here the condition is respiratory acidosis. What is the condition? It is respiratory acidosis. Okay guys, so the condition is respiratory acidosis. Okay, condition is what? Respiratory acidosis. Okay guys, and let's also check the hydrogen carbonate thing. Okay, hydrogen carbonate, what is the normal value? It is 22 to 26. Okay, 22 to 26. Okay, what is this value? 25, which is normal. Okay, here it is normal. Okay, so what is the thing? See, here acidosis has happened because of what? Because of CO2. Okay, acidosis has happened in pH what value? 7.20, which means acidosis. Okay, then while checking CO2 only, we found that the acidosis happened in the blood pH. But what actually contributed to acidosis? For acidosis, CO2 has contributed. Okay, if CO2 has contributed to acidosis, the CO2 should obviously increase, which is high CO2. Okay, and here HCO3. Okay, HCO3 is normal. So kidney has not done anything. Okay, kidney has not done anything. Okay guys, so it is respiratory acidosis. Hope you guys getting me right. Are you getting me properly? Respiratory acidosis. See, the rule for uncompensated ABG thing is rule for uncompensated this, what is this guys? What to say? Uncompensated thing is the pH should be abnormal, guys. Okay, pH should be abnormal. If it is normal, why we even think about compensating? Okay, the first thing is the pH should be abnormal. Okay, and the next thing is only one factor is abnormal. Okay, only one factor is abnormal and the other factor must be normal, because if at all it is also changed, then there should be some compensation occurred. Okay, it should be, there should be some compensation occurred. Since the other thing did not even fucking care about the change in the pH, so it is uncompensated. Okay, so here pH is abnormal, CO2 is abnormal, but HCO3, it should have done some compensation, but it did not do. Because how do we know that it did not do? It is in normal state. It is not normal state. It should have it should have, what to say, the HCO3 level should have increased to compensate the acidosis happened in the blood. Okay, but here it is normal, so it is normal. So what is this? So it is uncompensated thing. Okay, uncompensated. So this full thing we can call this as, what is this condition here? Acidosis. What is the basic thing? Uncompensated. So it is uncompensated respiratory acidosis. Okay guys, okay, this is the example for let's say, let's take this example. 7.55. What is this pH? 7.55. So it is more than normal. So more than normal in the sense, so it means it is alkalosis. Okay, it means alkalosis. Okay, what is CO2? CO2 normal range is 3.5. Okay, CO2 normal range is 3.5. So here guys, 3.5 to 4.5. So CO2 has actually decreased. Okay, CO2 is basic acidic in nature. CO2 is what? Acidic in nature. Its value is decreased. So what is the, what it means? Say it means alkalosis again. Okay, alkalosis again, and HCO3 minus. Okay, what is it? This is base. What is this value? This value is 25. What is the normal value? Normal value is again 22 to 26. Okay guys, so here the value is normal. Okay, it is 25. Okay, the normal value is 22 to 26. But here but I always told you CO2 always connected to lungs, and the lungs always connected to respiratory. Okay, and CO2 is low, which means here alkalosis happened, and since it is CO2 we have to connect it to lungs, and since it is lungs we have to connect it to respiratory. So this is a condition where alkalosis happened due to respiration. So it is respiratory alkalosis condition. Okay, hope you guys get it right. respiratory alkalosis condition. Okay guys, okay. Here, which is the culprit here? Culprit is lungs, because lungs only, what to say, it is breathing fast, so leaving out all the CO2 and no very less CO2 in the blood, so decrease in acidity, so it has gone to alkalosis. Okay, which you will understand if you just go through the PDF once, but I'm just trying to give you the uh, a general brief description. Okay guys, just comment down the video if at all, if my teaching is clear or not. Okay, this is, I'm not a tutor, I'm a student as well, and of course I'm a dumb guy. uh, so guys, partially compensated rule. Okay, the partially compensated, what do you mean? The first what we have studied is uncompensated, which means the two abnormal. Okay, two abnormal, the other one must be normal. Okay, the other one must be 100% normal. Only this means this is not at all compensating the problem. Okay, only then it can be normal. Okay, partially compensated. Let's see what is partially compensated. What is the pH is 7.21. Okay, 7. What is the normal value? 352 4 5. 7.21, it is acidic in nature. Okay, pH is acidic in nature. Okay guys, then what is PaCO2? Normal value is 35 so here CO2 value is increased, again it is acidic. Okay, okay guys, so here this uh, two things are dominant, so the condition must be acidosis. But what acidosis, since the culprit here is, the problem is acidosis, the culprit here is what? The culprit here is the lungs. Okay, the culprit here is lungs, so it is called as respiratory acidosis. So it is called as respiratory acidosis. Okay, respiratory acidosis. Okay, let's now check the other component. Okay, if the other component value is 39, what is the normal value is 22 to 26. Okay, but here it is increased, but here it is what? It is increased. Okay guys, which means HCO3 increased means more alkalosis is happening. Okay, more alkalosis happening. Are there any normal values? No normal values at all. What is the problem here? Acidosis. See the pH. Problem is acidosis. What is who is the culprit? Lungs are the culprit. Okay, so respiratory alkalosis. Okay, very specifically, which is partially compensated. Why the values of the kidney is increasing? If at all it is normal, then we should consider this as uncompensated. But see, this CO3 value has increased. CO3 value has HCO3 value is increased here. HCO3 value is 39, which means it is increased here. What are the kidneys trying to do? It is trying to push out all the hydrogen carbonate ions into the blood, and it is trying to compensate. It is trying to compensate, not fully compensated. If at all fully compensated, the normal level would be, if at all fully compensated, the normal pH value would be, the pH value would be normal, but here the pH value is not normal. Okay, but then all the other values also abnormal, so this is a condition of what? In this particular case, it is a condition of respiratory acidosis partially compensated by metabolic alkalosis. Respiratory acidosis partially compensated by metabolic alkalosis. Why metabolic? Here what is actually metabolic means, which organ should remind you about metabolic? For to remind you about metabolic, the kidney must remind you about metabolic. Okay. Hmm. So here kidney is only trying to compensate the problem which was created by the lungs. The problem here is acidosis. Okay. Okay, guys. So this is called partial compensation. Okay. This partial compensation means which is trying to compensate. Okay. If at all it is fully compensated, the normal would be, the pH value would be normal. Okay. Then third one is what? Third one is fully compensated rule. So the fully compensated. What scenario fully compensated? Here pH is normal, guys. Okay, pH is normal. Okay, which is the normal pH is 7.35 to 7.4. Okay, it is 7.35 normal. 37. So it is normal. Okay, let's see other values. Okay, CO2 normal value is 35 to 45, but CO2 increases, so it is acidosis. Okay, CO2 is increases. So here respiratory acidosis. Okay, yeah. is HCO3 minus. What is the normal value for HCO3? Normal value is 22 to 26. It is also increased. So it is metabolic alkalosis. So it is metabolic alkalosis. Okay, with just these three values, this is our primary interpretation. Okay guys, primary interpretation is what? 7.3, 7.37, which is normal, because normal pH value is 7.35 to 7.45. But remember your girlfriend. What is the ideal value for your girlfriend? Okay, just like your girlfriend, what is the ideal value for pH? It is not 7.35 between 7.45. The ideal value is 7.40. Okay, ideal value is 7.40. Okay, the normal is 7.35, just like other neighboring auntie or neighboring the one we see in bus and other, they are like normal. Okay, they are like normal. Okay, they don't they are like very much normal. Okay, 7.35 to 7.45. Okay, but the ideal one is your girlfriend, which is 7.40. Okay guys, see here, these two things are abnormal. Okay, here these two things are abnormal. Okay, how we will find what is actually compensated to what problem? I'll tell you here. Okay, since it is normal, how we can find this thing we know? Okay, this thing we know, these two are abnormal, just CO2 and CO3. Here HCO3 is abnormal. Okay, but the pH is normal. So here guys, here I have told you 7.40 is ideal. 7.40 is ideal. Okay, what if it is slightly this side, which is towards 7.35, and that side 7.45? If it is that side, the problem would be alkalosis. If it this side, the problem would be acidosis. So here what is the value? Here it is 7.35, less than 40. So the primary problem was acidosis. Okay, the primary problem was acidosis, and here CO2 value is also increased. Okay, the problem was, it was respiratory acidosis. The main problem, the core problem was respiratory acidosis. Hope you get it right. And it is compensated by this kidney thing, HCO3 minus. Okay, by increasing the HCO3 ions. Okay, that is why alkalosis value, this HCO3 values has increased. Okay, so the thing is, respiratory acidosis fully compensated by metabolic alkalosis. Why metabolic? Because kidney has compensated the respiratory problem, which is problem created by CO2. Okay, which is complicated by lungs. Okay, here fully compensated. Okay, but in case if it is partially compensated, the values would not come inside this normal thing. Okay, but in fully compensated, even though it is normal guys, it will not be idle. Okay, it will not be idle. Okay, this is very, all these are simple things guys. You'll understand it once you go through it properly. So yeah, general conditions guys: metabolic acidosis. Okay, DKA, where our body burn fat, and it produces a lot of ketone bodies, acidic diarrhea guys. Our stomach has a lot of HCl, and the HCl is out during diarrhea. Like hey, during diarrhea, no, 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 no. See, the diarrhea thing is also a diarrhea thing, guys. The poop water, okay. The water in the intestine is rich in hydrogen carbon, rich in bases, okay. So, if it goes out, metabolic acidosis will happen, okay, guys. Then renal failure. What does renal failure do? Renal failure, I have already told you, kidneys are the one which absorbs the HCO3 and releases H plus. But if renal failure happens, then HCO3 will be absorbed properly. Then the H plus would be built there. Okay, H plus would be built there. So again acidosis will happen. Why? Metabolic because this kidney. Okay, then lactic acidosis, we all know lactic acidosis, muscle releases lactic acid in case of absence of oxygen. That released lactic acid is get into blood and causes this acidosis. Next, metabolic alkalosis, vomiting, guys, vomiting. Stomach has a lot of HCl and you vomit, HCl is taken out, so in decrease in acid, so alkalosis. Diuretic, guys, what usually it does is it what to say, sodium is actually released out, but when we take diuretics, guys, sodium is retained. Our body panics, and what does it do? It activate aldosterone, which of course in this case Na is retained, but here the catch is the Na should be retained. Here potassium is actually excreted. Okay, potassium is actually excreted with along with H plus, so making the blood more basic. Next, hypokalemia. Hypokalemia, the same condition, since potassium is excreting, hypokalemia. Okay, guys, remember potassium K plus. Okay, K plus. Potassium is acidic, guys. Sorry, potassium is actually, yeah, potassium is actually acidic. Keep that in mind. Potassium is acidic. This will help you. Okay. Next, guys, respiratory acidosis, basically slow breathing scenario, guys. If you breathe slow, obviously what will happen, the CO2 release through our nostrils will be decreased, so the acidity level will increase, so respiratory acidosis, respiratory alkalosis, anxiety, you breathe very fast, high altitude, again you breathe very fast. During pregnancy, guys, what happens is this is also you actually breathe slightly faster. And early salicylate, what is salicylate? Salicylate is aspirin, guys. Aspirin, okay, taking in, it will increase the it will cause hyperventilation, so more CO2 release. Okay, early, guys, very importantly, early salicylate. Okay, this aspirin has two types. Okay, aspirin has two types. Okay, at early it acts as hyperventilator thing, and then it actually causes metabolic alkalosis in the second part. Okay, late phase, it metabolic acidosis. Okay, it causes metabolic acidosis in the second part. Okay, it causes metabolic acidosis in the second part. First part, it causes respiratory alkalosis. Okay, second part, metabolic acidosis. Totally different. This is a very severe condition. Then comes the anion gap, guys. What do you know between? See, what do you know about this anion gap? Guys, anion gap, basically, guys, we are decreasing, that is subtracting the anion total anion values from the cation values. Okay, this is called anion gap. Okay, it is done to check if the metabolic acidosis, it is what type, it is high end metabolic, it is high anion gap metabolic acidosis, or it is normal anion gap as a metabolic acidosis. Okay, 8 to 12 is the normal range. Okay, guys, if it is 8 to 12, it is nagma, which is a normal anion gap metabolic acidosis. And if it is more than 12, then it is high anion gap metabolic acidosis. Okay, okay, the normal is 8 to 12. Basically, guys, here what we consider is, we only consider sodium as our cation, and for anion we consider chlorine and HCO3. Okay, chlorine and HCO3. Okay, what we do not measure is, for cations we don't measure potassium, calcium, magnesium. For anion, protein, phosphate, but both are present in the plasma only, that we already know. Okay, guys. Mm, very important, guys. Normal value is 8 to 12. Okay, 8 to 12 is normal nagma, normal anion gap metabolic acidosis. More than 12, it is high anion gap metabolic acidosis. Keep that in mind. Next, this high anion hagma, it is seen in gold gold mark. Okay, the seen in gold mark, guys, it is the mnemonic. Okay, glycolysis, this is acidosis, oxapamine, again acidosis, lactic acid, all acidosis, methanol of course forms formic acid, acidosis. Renal failure, guys, I've already taught you renal failure. Kidney fails to excrete H plus. Aspirin, guys, aspirin on the we already know. In the we have already studied aspirin, that is salicylate. Okay, in the first phase, what does it increases ventil, that is hyperventilation, so CO2 is released out a lot, so that causes respiratory alkalosis. But in the second case, it causes metabolic acidosis. Okay, second phase, what does it causes? Metabolic acidosis. Then ketoacidosis is ketone production. Okay, ketone production, ketone bodies are acid in nature, so metabolic acidosis, normal anion-cap metabolic acidosis. Diarrhea, all know, guys, diarrhea means H plus HCO3 ions are present in the intestine, in the poop water. When we actually diarrhea, all those are lost, so leading to acidosis. Okay, then renal tubular acidosis. For renal tubular acidosis, guys, the thing is, basically our body will pee out bicarbonate. Okay, body will pee out bicarbonate, and there are two types. Okay, but both the types actually contribute to this acidosis only. Okay, type 2 வந்து cannot reabsorb HCO3, type 3 வந்து cannot excrete H plus. Okay, okay, carbonic anhydrase, guys, this enzyme brings back HCO3 in blood, but if at all we give inhibitors, then obviously it can't bring back the H plus. Then uretrosigmoidostomy, here, guys, high chlorine and less bicarbonate. Okay, this is when the ureters are connected to the sigmoid colon. The sigmoid colon, actually what does it do is increases chlorine, and it does not, or takes out the or releases the bicarbonate. Okay, this is quite a condition, guys, this is quite a condition. Okay, where this sigmoid to sigmoid colon, the ureters are attached. Okay, okay, so in this condition, again, acidosis will happen, as it will not take bicarbonate. Okay, then Fanconi syndrome, here kidney cannot properly absorb anything, which of course HCO3. Spironolactone, guys, spironolactones are diuretic. What are these diuretics? They are potassium sparing diuretics. Okay, they are potassium sparing diuretics. What does it do? Okay, guys, always remember, spironolactone already a potassium sparing diuretic. Okay, aldosterone, what does it do is, guys, aldosterone actually acts against the potassium. Okay, aldosterone acts against the potassium. Spironol are the diuretic that blocks the aldosterone. Aldosterone normally tells the kidney to dump H plus and potassium into the urine. Okay, but what happens is, when you block this aldosterone, this particular acid, this H plus thing stays in the blood. Okay, guys, hyperkalemia, leading to hyperkalemia, as there is no aldosterone at all. Hope you guys understood it. Simply just go through it, guys, you will itself understand. The basic thing is, just to know all this value, understand if what is the acidic or alkaline spectrum decreases, mug up these values, know what if it decreases, if it increases, what if it decreases or if it increases, what if it decreases or if it increases. Okay, that's it. Second point is CO2, what organ, what can we use, what word we can use? CO2, what organ? Lungs. Word we can use? Respiratory. Hydrogen carbonate, what organ? Kidney. What we can use? Metabolic. Okay, what word we can use? Metabolic. Three things: compensatory, fully compensated, partially compensated, and then uncompensated. Uncompensated, the two abnormal thing, which is pH will be abnormal and another will be abnormal and another one will be normal. Okay, partially compensated means what will happen is, guys, all the three, okay, partially compensated means all the three will be abnormal. Okay, fully compensated means the pH will be normal, but the other two will be abnormal. Okay, for this particular thing, for finding what was the problem, we have to know the ideal value of pH, which is 4.70. Okay, again another quick revision for anion gap, guys. What is the normal value? It is 8 to 12. 8 to 12 normal nagma, that is normal anion gap metabolic acidosis. More than 12, it is high anion gap metabolic acidosis. Here what we only check is, for cation we only check sodium, for anion we check chlorine and HCO3 minus. But what we do not check is, which we do not consider, is potassium, calcium, and then magnesium. And in anions, what we don't check is proteins and what else? Proteins and phosphates. Okay, proteins and phosphates. This thing. Okay, what is the formula for anion gap finding? Cations minus cations minus sum of anions. Okay, sum of anions. What anions? Cl minus and HCO3 minus. Okay. Hmm. Hope you get it, guys. Okay, I'll put this thing in our Telegram group.